Hey, it's Jessica Namasa with WTF Health. What's the future of health? I am talking to the who's who of health tech and healthcare innovation. And I have big news under embargo. This lady right here is announcing to me her Series B fundraise, $10 million. This is Anna Lindow. She is the CEO of Brave Health, which is a mental health company specifically targeted for the Medicaid market. Anna, I have so many questions. It's so great to have you here. Congratulations.
Thanks for having me.
Let's start there with a congrats.
Thank you so much. I really appreciate it.
All right, we'll get into who invested in the round and what you're going to do and all of that stuff. But for those who might not be familiar with Brave, why don't you tell us what you guys do?
Absolutely. So Brave is a virtual behavioral health provider.
Okay.
We operate in 10 states. We focus on the Medicaid population, just like you said. And we provide the care, but we also have a care navigation platform that helps us reach members that can sometimes be difficult to reach, and also integrate and liaise with their other providers and their health plan.
Okay, so I want to unpack all of that. So I understand there's therapists or counselors that they can interact with to actually get to the care that they need, and then talk to me about the integration side, because that sounds like it might be the secret sauce here.
Absolutely. So I started my career in audience development, all about getting traffic to websites. And what I learned there,
I might need to ask you some more questions, Anna.
that was my first job many years ago. And what I learned doing that was you have to go where the eyeballs are, right? That we want to find people where they're already at. So taking that same principle in healthcare, it's so scary to get care that you haven't gotten before. Even if you have gotten the care before, I'm scared as a patient when I'm seeing a new provider, right? So we want to go where the trust is, start there, and then work with the patients in concert with the individuals, providers, organizations that they've already built trust with, right? Okay. So what that means in practice is we go to their health plan. Maybe they're working with a case manager. We go to their primary care provider, right? Maybe they've developed a good relationship with that person. Or maybe they're coming out of the hospital and there's a discharge planner working with them to figure out their next steps, and we go there. And those are the organizations that refer to Brave. Then our amazing Access Center picks up the baton, reaches out to the individual, and helps them overcome a few things that can come up for a lot of people who are trying to pursue behavioral health care, again, sometimes for the first time.
All right, like what?
Okay, could be, I don't have an email account. You're going to send me a link to my email. What email? Let's figure that out. Okay. So we'll help you set up an email account. It might be, now what's this? Is this confidential? Is this private?
Okay.
I'm not sure if this is for me. Well, let's talk about that. Let's work through that together, right? And it might be, what kind of a provider am I going to see? Is it going to be a psychiatrist? Can they prescribe medications? Is it going to be a therapist? What can I expect? How am I going to get in touch with you if I have a question or I need you later? Does my insurance cover this? All those questions are great questions for a person to ask about their healthcare, right? But we're not really so used to, as a society, being able to get our questions answered in real time. We're kind of used to be a patient, don't be a patient, right? That's the way it's set up. And our amazing providers across the country do incredible jobs delivering care. But I think as a society, we need to do a better job helping people get their questions answered and reduce some of the fear that we have, some of the stigma that we have, some of the just curiosity and confusion we may have as we start our journey on a new type of care.
Okay, so I mean, the double challenge here is not only is it mental health, which is scary for a lot of people, especially if they've never done that type of treatment or there's stigma attached to it, which is lifting, I think, but still, not as easy as other things, right? And then also the Medicaid population. And it's like, I've interviewed a lot of people and who are, often say, like, a lot of times it's investors, there's no money in the Medicaid population. How do you run a business like that? That population of patients is so difficult to engage. And it's like, I don't know how true that is and how true that's not. So Anna, you're working with them. How difficult is it to engage the Medicaid population and then add that extra layer of in something like mental health care?
Well, like I was saying, it's not magic. It takes work.
Yeah, I'm sure.
And like I said, we are really fortunate to have an amazing team that does that work. People who worked at hospitals, people who worked as 911 operators, maybe people who are peer specialists, right? Those are all important components, but it also takes technology. We have to keep track of hundreds and hundreds of people who are possibly interested in starting care every week, right? Doing that with just your standard EHR and maybe your phone with a cord and a fax machine is really hard, right? So I think the deck is kind of stacked against providers who don't have access to all the tools they may need. So what we've done at Brave that's really helped us is build those tools. The first version of it was a CRM that I built at like 2 a.m. using it out of the box platform, and lots of things have changed since then. And now, of course, we have a sophisticated platform, but with technology, with people, with tools, and with the amazing community health team that we have, all those things together mean that it is possible. It just takes some effort.
How much of this is tech and how much of this is human? Like, give us a sense. Like, you're talking through the part of the tech platform. I want to hear a little bit more about that. But like the thing that the engine underneath this that makes it work, that makes it sticky with patients, how much of it is people and how much of it is technology?
I think engine's a good word for it, right? We don't want...
It's not my first startup interview.
She's done this before,
I've
folks.
done this before and
Yes. So I think engine's a good word for it because you don't see the engine,
Yeah.
but the engine's running, right? And I think that that's a helpful analogy because we actually don't want people to think they have to be technology whizzes to use our tools. Like I said, sometimes we're helping people get their first email account.
Right.
We don't want them to think, I got to download this app and I got to figure it out and it's not working, etc. We actually want to make something that's as simple as you get a text to your phone, you click the button and you're in the session, right? We work hard at that. It's not easy and it takes time. And honestly, that's, I think, something that's going to be our journey for the next decades as we build this company, right? It's how do we make it feel like magic to the patient, magic to the primary care provider, magic to the health plan. If you want to fax me, go right ahead. And on the back end, we want to make it work for you because the last thing we want to do is try to change the behaviors of millions and millions of people around the country around technology when what we're really trying to do is change their behaviors around their health, right? We don't need another barrier. And so I think the philosophy we use is let's have this happen behind the scenes in a way that gets smarter over time, is driven by data, is in support of outcomes, but isn't super high barrier to the end user.
Okay, so talking about that engagement in helping those people, improve their health rather than engage with the technology. I want to hear about this because this is one of those things. Like, talk to us about the Medicaid population. I don't get to talk to a lot of startups that are in this space. I talked to, Sean Lane, the CEO of Circulo, about their new Medicaid plan. I've talked to Toyin Ajayi from City Block. I mean, and they've done the best job about articulating their model. But it's when it comes down to engaging that population, it's I think there's, generally speaking, a little bit of a hesitation because I think people just maybe don't understand. So what you said beautifully earlier was about how sometimes you need to help them set up an email address. So give me a little bit more color on engaging with a Medicaid patient, particularly around mental health.
Mm-hmm. Well, I'm actually not sure that it is so different than, let's say,
Anybody else?
Anybody else, right? I'm not sure that it's so different than anybody else. I think what we are dealing with in our country right now is that there has been a systemic, long-term lack of access to resources for all of us, right? As a country, we have had a lack of access to resources on the behavioral health side, but it's been particularly pronounced for Medicaid. Okay. So what we see is behaviors that we don't necessarily think are serving anybody, but are just what it is, right? That could be a lot of utilization of the emergency room, right? To receive services that could be provided outpatient. That could be people who maybe have been hospitalized several times and haven't necessarily gotten connected to outpatient care as they've left. Because guess how that happens? You just get a piece of paper that says, hey, maybe you can try walking into this provider, right? So again, it comes back to that, where's the trust? And how can we give people a new option at the place that the trust already is? Which is why we're so excited to partner with companies that like Circulo, who are doing cool things in the space because we can build solutions together and we can build that trust together. But in practice, it may be something as simple. It may be something.
There's a party bus going by right now here at Health.
It may be something as simple as plugging into the discharge planners at a hospital, like I was saying, right? And then one day post-discharge, hey, this is Brave Health. We got a referral from your discharge planner at the hospital. Let's talk about your options, right?
Very cool.
Frankly, I think that approach makes sense in any healthcare setting.
I agree with that.
But to talk to your other question about how do the economics work in Medicaid, one of the things that's so cool and elegant about Medicaid is publicly available information. You can download the fee schedule, and that's how I started this business. I downloaded the fee schedules off the websites, right? You can I called friends in private healthcare and I said, hey, what do you pay for this and this? I'm trying to model a business. You can't get that information. That's not public, right? But with Medicaid, it's transparent. We know what you're paid. We know what the state has focused on, what measures they're trying to move, how they measure success. That's going to be what the plan cares about. And then the really cool thing is, the provider, us, and the health plan, we have the same objective. We're not at odds. They're not. When we're talking about the mental health services that we're providing, they want their patients to get this care. And this is why something I talk about a lot is that the case managers at health plans are just unsung heroes because they are trying to connect people to services, right? So when we raise our hand and say, hey, we're ready, they say, great. right? This is not an adversarial relationship. It's a
No, like,
partnership.
thank God.
It's working. And so I think that aligned incentives piece is something that I didn't realize before I worked in the space. That managed care organization has to make care work for that person. And if that individual is using the hospital a lot, that's not good for the individual if they can get their services in an outpatient setting that will work, and is appropriate. And it's certainly not good for the health plan. So we're on the same page, right? And I think that's something that it's been really refreshing to see investors get more familiar with and wake up to. And I'm hearing so many investors now talk about the space, which is great because we want more innovation, right? The work that Toyin is doing and the work that the Circulo team is doing and the work that the other great Medicaid space, startups in the space are doing is starting to get more awareness and just recognition.
Yeah, absolutely, and you're proving it can be done. All right, so you've mentioned investors, so let's talk about this. Let's talk about this secret round for a second. So I want to hear more about the round, and I specifically want to know what it's going to do for the business. So talk to me about where you guys are at now, number of employees, like what are you guys doing, what are you building? Work in the investors, talk about the round, and what you're going to do with that money.
Cool. So a couple things. First of all, we have a bunch of amazing providers around the country. Right now, we're operating in 10 states, and we're going to continue to grow. Okay. So that's one of those things, one of the barriers with Medicaid that I do think it's important to call out, because I would not want to create the misconception that this is easy, right? No. But when we think about part of the reason that we have some challenges, it's state by state. Yeah. Right? We're doing new things in every state. So when we think about expansion, we have to be really, really intentional about where we go, how we build presences in new markets, who we partner with in those markets as we enter them, et cetera. So there's that geographical expansion piece. Then there's the continuing to build technology piece, right? Okay. We can always do more to make it feel like magic to our stakeholders, right? And then there's just continuing to build our awesome team, right? So we're about 200 people now. About 120 of them are providers. We have about, I think, 30 to 40 in our fabulous access center that I was telling you about. Awesome. And then the rest of us are doing the other functions the company needs to grow.
Awesome. This is so exciting. Well, congratulations on your Series B. I'm like, I want to whisper because I don't want anybody to overhear. But this is so cool. Thank you for coming on and announcing it with us. This is awesome.
It's my pleasure. And I would love to give a quick shout out to my amazing investors. I meant to work that in. So we have, as you asked, we have Union Square Ventures has invested. City Light led their round. They're amazing. They do a lot of work in Medicaid. The Union Square team has been incredibly supportive since the beginning, and Able Partners joined this round as well. They do so much in health and wellness, and so we are just lucky to have, like I said, continued and increasing awareness around the space, but also just people who really believe in what we can do to make change.
All right, awesome. Anna, it's so nice to talk to you. I'm so excited to give visibility to what you guys are doing at Brave Health, and also to those investors who came in on the secret Series B. Thanks to them too, because this is a hard space to invest in, and so I appreciate the fact that they're putting some financial backing behind a company that's definitely got a great track record so far and has every intention of going even further. Awesome. Great. All right, Anna, thank you so much for stopping by. I'm Jessica DeMassa. Thank you so much for joining us. If you want more interviews with the who's who of health tech, go on over to my YouTube channel, youtube.com/WTF Health. We'll talk to you guys soon. Thanks again. Congrats.